I'm going to hide myself and I will start the webinar now. Good luck, everyone.
Greetings, everyone. Welcome to Agilion's webinar on how Medicaid payers use AI and analytics to ensure continued coverage. We've got a pretty packed agenda, but it's going to be more of a conversation. My name is Brent Gendelman, and I'll be your host for this engaging session where we're going to explore how advanced technologies and innovative strategies have helped Medicaid payers tackle disenrollment challenges and ensure members maintain access to essential benefits. We are really fortunate to have two incredible experts with us today who bring really deep experience and actual insights to this discussion. First, we have Kat Lawrence, who is a principal at HMA, and we have Marty Brown, who is a Medicaid data SME at Agilion. The two of them not only bring insights up today, but have a long history of working together, and we're thrilled to have both of them here to share more about our experiences and theirs with the Medicaid ecosystem. Over the last 18 months, we've really experienced a crisis in redetermination. And the slides that you see here are really just kind of talking points for our team. What I most want to start with is to really ask Kat a bit about the context of how she has acted as a Rosetta Stone, helping both our development teams and kind of Medicaid executives understand what they're dealing with and the best way to move forward. Could you share more, Kat?
Sure. Thanks, Brent. Kat Lawrence, HMA, but I've been in the Medicaid universe for over 15 years. And one of the things I think that has really been one of the hallmarks of my career is the translation between policy and programmatic work, operational work as well, and the technical systems. And I think, especially leading into this topic today, one of the biggest, I think, grounding is you have a lot of experts in various things. You have operation managers, caseworkers who really know their work, right? Call center workers, you have technologists who really know how to develop software, but it gets lost in the middle between the translation between these languages. And so in working with development teams, I think it's really important to have on the ground support for the business side to really make sure that what they're saying as the policy is translated into this. And especially for MCOs, I worked last year with HSCSN and really working with them to make sure that their technical teams understood the implications of all the policy coming down for the unwinding.
One of the other kind of topics I was curious about with specifically with you, Kat, is how has your experience kind of across at the state level with their ability to thoroughly test kind of the outputs of their eligibility systems? How has that been in your work?
I think that having worked with almost every state except Alaska, especially during my time at AWS, I was trying to get up there. I mean, something happened with a flight. I don't know. But I think that what's really critical is in government, there's diffuse decision making. And one of the things that I think it's often overlooked from technology groups is that is supposed to be how it works. So there's not supposed to be like one throat to choke and who makes all the operational decisions, who makes the finance decisions, who makes decisions for SNAP, long-term care. There is diffuse decision making for a reason. And so you really need multiple teams to be able to come together in a way that government was really not necessarily structured to work to operate a program. And so I think the key to finding out how to launch these large scale systems is finding out what way works first for that state in order to facilitate the needs of a software development cycle, which needs decision making, not in the diffuse way that government is set up. So one thing I've noticed consistently across all the states and territories I've worked with is there workforce challenges. It's strapped to provide as many people, if you can keep every team having need just one representative, but then you also need a type of structure where everyone needs to have their voices heard, because one can't make a decision for the other, and that's intentional, right? And it's how it's supposed to be. So I think it's been a challenge, and really something I think it's really worth discussing long before an implementation, or even during an implementation. How are you going to make sure that the right people are in the right room making the right decisions in a way that facilitates how their state runs their business? And I think once those kind of conversations can be had and decisions can be made up front, I think that is where I've seen success, and where I've also seen a lot of struggles. And that goes for testing, business development, as far as their functional design development, the business side. I think that is a key thing that is needed.
So one of the things I hear there, and maybe Marty, you can jump in here as well, is that often the agencies and the technology teams are pretty well suited to execute their specific role. Medicaid in specifically, but like not unusually, is something that requires a lot of translation no matter what. And those are usually outside of roles that are comfortable, either because the development team doesn't really know the language well enough, and the government folks might not know how to translate the regulatory space into something that makes sense to make decisions on a daily, weekly, monthly, quarterly basis to roll these things out. From a logical point of view, Marty, often representing those technical teams, how has your experience been related to this topic?
Yeah, I think that's a really good point, Brent. I think most the problems that we encounter are problems of governance, which is really what Kat's talking about when she talks about diffuse decision making. And you do have to get the right people in the room, and they have to be empowered to make those decisions for the team to know what they need to build and to move forward. And we've been fortunate enough when Kat and I worked together in DC. We had a pretty great team. She was representing the business side. We had some other folks representing the business side, and our company played the translator role with the vendor who was producing the eligibility system, which was brand new for the Affordable Care Act. And there were a lot of bugs in it. And what we wound up doing was producing a core set of test cases that everyone agreed on were the most valuable test cases to ensure that the eligibility system was working properly, and agreed on all the outcomes from those tests. And so that really became our eligibility Bible, if you will. But the reason it worked is that everybody had buy-in up front, that those were the right cases to run, and that those were the right outcomes to look for. And I think that's really crucial to solving any problem, is getting everyone on the same page and running the play that really President Obama created during the Affordable Care Act implementation, when there were so many problems at the federal level with the rollout. He created this code red team of industry experts to come together and just get the thing working, solve the problems. And the key element of that team was creating a culture of no blame, where everyone could bring forward anything that they noticed that was wrong, whether they'd done it or somebody else had done it. And there was really no blame. It was all about workability. The first thing you have to do if you're going to make things better is you got to know what's broken. And creating that kind of no blame culture in partnership with the state and managed care organizations, the regulators, the payers, all of it is really vital, because the entire ecosystem has to be fixed if we're going to fix eligibility and care for Medicaid recipients. You can't focus on any one little thing and expect that it's going to get solved. So, yeah.
Excellent. In the last 18 months, Marty, how have you seen that impact kind of your work day to day?
Yeah, I mean, we've been working with multiple MCOs in various states to try to help them figure out what's going on after the public health emergency and the Medicaid unwinding. And they've had, a variety of issues. most of them driven by logic errors in the eligibility system that sort of couldn't keep up with the volume of redeterminations that had to happen after the PHE. And we've seen things like somebody qualifies for Medicare now because of their age, and suddenly they're dropped from Medicaid instead of being put into a dual Medicaid Medicare plan. And these are folks who are unquestionably deserving of Medicaid benefits. But the system doesn't know how to handle that transition to Medicaid qualification properly. And so the person gets dropped from Medicaid. Other things we've seen are like coverage gaps where someone's eligibility period, there's a grace period after it ends. They get their paperwork in during that grace period. The state has said, we'll make sure we cover you retroactively. And that's the state's intent, but the state system doesn't carry that out effectively. So lots of logic errors impacting people, and most of them going undetected until we started to dig into the data for our clients. And that's really been our approach, is to leverage the data to find the errors. And mostly we've had to compare the information coming out of eligibility systems with the information coming out of Medicaid management information systems, MMIS systems, because they rarely are in sync. Even when they're controlled and owned by the same state entity, they don't synchronize well. And the people on the ground at these MCOs, they know which system that is more reliable. Like they're in it every day. They're in the trenches and they're trying to make this work without a lot of system support. And so if you get your folks on the ground engaged, show them the data that they haven't had visibility to because of systems not offering it to them, then you can follow what I call their spidey sense, right? They all have really good intuition that's based on years of experience and real experience with Medicaid recipients. Then they can help guide the team into what to look for next, for how to uncover what's the most likely place of where this problem is occurring and how to make sure you catch everybody that's falling into these gaps. And that's what we found in multiple states with our work, is that the collaboration between the data analysts, the executives at the MCO, and their frontline people who are really doing the work every day of trying to get folks redetermined and re-enrolled, is a magic combination for locating areas of problems and finding people and trying to get them back on the Medicaid books so their benefits don't lapse.
Pat, when you think about your experience across, let's say, the lower 48, how does that resonate with you? Does that sound about right? And what did you find people could do, either from an MCO point of view or from the state point of view, to address this issue?
I think one of the things I found is that it's very difficult for states, no matter what part of their transformation they're in, to deliver their benefits. And Medicaid is, without understanding a little bit of the history that Marty was talking about, like when this all started with the Obama and his changes, with the Magi Medicaid updates. But I think it's very important to realize, like, folks weren't sitting around and ready to just make these changes, right? And I'm saying that flippantly to mean that it wasn't already built that way. Like the government wasn't working in that fashion. And so then if you just layer IT on top of it, one of the biggest, I think, hurdles and setbacks to the implementations of the eligibility systems that we're talking about is, like, they use the "if we just build it, it will work" methodology. And that is not a tested methodology. And I think that laying it on top of business processes that haven't been updated, it didn't make Magi Medicaid work because it was never there, right? And so I think it's about that change and having folks say, okay, we need to maybe transform how we were doing our business. In the middle of it, if you have a timeline, though, pressure's on, you got to just, you got to get things out. But I think that really slowed down a lot of the implementations because new regulations were coming out, new processes were being done, people were being trained on new things. And then all of a sudden, it's already at like 2019, 2018, and folks, states are really, I started seeing them coming together, folks were getting fixed, and all of a sudden, people are walking around like with 200 things of toilet paper wearing like a wetsuit, right? And we're in a public health emergency. And so in that case, right, the system has to change again, and it's all also very rapid. It's like people are just like, needs to happen today, yesterday. And so I think that the context of what's been playing out for the past 10 years has really hit Medicaid hard from a process perspective, as well as benefits perspective and a technology perspective. So I think in doing transformations where I've seen things be really nimble, in states who have already said, okay, I don't want to solve for the problem today, I'm trying to solve for problem X so that this never happens to us again. And so really making their technology structure help them as, when the next crisis, hope not, right? But something's going to happen, hurricane, whatever it is. And so that they are able to test quickly, change quickly, and do whatever it needs to be done. Those were the states, and I saw a few, two at least, that I worked really well, where they were like, they already built it after the last challenge. And so when something else happened, like COVID, they were really ready, and they were able to stand up and get their data out there and process the changes. I think to Marty's point, when you're talking about working with the systems and doing the core testing of the cases, one of the things I think that began to happen, and some states took a lot of time during the COVID pause to really look at which people weren't at the table the first time, because not everybody was there. And I mean by that, like all the, maybe not all the caseworkers, maybe the long-term care was left out, some, it was rapid, things were happening fast. And so kind of going back and making sure to shore up those things, and tracking that in a concerted fashion allows them to be more nimble in the future as their programs change. And I think that's one of the critical things that I've seen is getting ahead of things is best. But when you can't do that because you're trying to actually run a benefits program, you also have to take things in small chunks and see how you can incorporate real teams that need to be incorporated in real time, and make sure your IT team is right alongside you in order to keep up with the latest technologies to enable those nimble changes.
I think it's really well said, and it kind of feeds another idea. Marty, could you talk about how, kind of building off of Kat just shared, how the revolving doors of eligibility really challenge that combination of teams to keep up?
Yeah, I think sometimes the analogy we use in IT is that we're flying the plane as we're still building it, right? And I think that's what Kat's talking about with trying to make changes to the systems and also have them operate effectively today so that people don't get left out. And we've definitely seen in multiple states where the issues in the eligibility systems at the state level cause a person's eligibility to go on, off, sometimes multiple times in a single day, sometimes just multiple times in a single month, but none of it is really makes any sense, from a logical perspective. And so then you're left, like the organizations who are receiving these eligibility files, 834s from the state, are left trying to figure out what's actually true about a person's eligibility, and to identify the people that they need to come in contact with to make sure that their benefits don't lapse because they haven't filled out the right paperwork in the right amount of time. And that, that's so challenging. So I think one of the things that we've been able to do, which has been super helpful, is to automate our comparisons of the eligibility data and the MMIS system to help MCOs get information more quickly about who might be falling through those cracks. And that way they can get those folks to their community relations teams, their outreach people, and try to get in touch with them. Because a lot of what's happening after the PHE with the unwinding is people moved around a lot, right, during the pandemic. And so, and if they didn't need to recertify for several years and now suddenly they do, that contact information for folks is wrong. And it's often right in the MCO's like management system themselves, like their care management system, but wrong in the state system. And yet the systems are designed to take the state contact information and overwrite what's at the MCO level because it's supposed to be the trusted source of truth. And so it's a real challenge to not only to find people, but just to hang on to the information that's good about where people actually are. And we've seen MCOs who have less than a 50% chance of finding the folks they need to find when it's time to get them redetermined and re-enrolled. And that's just, it's heartbreaking because these folks really need those benefits. And, you know, it seems clear from the kind of care and plans that they're in that that they have not graduated from a need for Medicaid. You know, they're still qualified, but we can't jump through the right procedural hoops to keep them qualified. And so I think automating those comparisons between the two systems and getting creative about how to find contact information for people and how to hang on to the good information that MCOs have is one thing that helps increase our chances of getting in contact with people who need to be re-enrolled.
So with the remaining time that we have, and it's short, if the two of you were to just consider what you would recommend, either with AI or automation or analytics, how to help either anybody in this ecosystem, how to stop digging the hole that's being dug. What would you recommend kind of strategically for these folks to consider as they move forward?
I off the bat, because I was already like getting ready to steal Marty's time. She touched on one of my soapboxes, one of my many, but have a data strategy. I cannot say it enough. I've got t-shirts. I can sell merch. Have a data strategy, because one of the things that the states I was referencing that were able to be nimble, they created a modern data strategy because, you know, we are in 2025, and, you know, when we talked about missing addresses, things like that, I'm like, Amazon can find me anywhere and deliver a package. Okay, I can be in Montana, I can be sitting on the corner, all of a sudden, like the truck boop, pops up, right? And so they know, we're like, let's be honest, you know, you're known. We know where we are, and you know, barcodes can track things. You know, you can have a little bodega down the street, they have barcodes, they know how many lemons they sold. I'm just saying the technology is there. I think having both technology groups work really closely with state groups to really figure out how is their data structured under what their systems now, so that John Smith, MMIS, eligibility, these are things we talk about. People call it the golden record. I don't really care, you know, what you call it, data lake, data submarine, whatever you have, but you need to have a strategy that says you are maintaining the data for your constituents, and then you're able to more nimbly pull that data into whatever system is needed and be able to act on it from all the different platforms. I think that's where you start getting the real technology transformation that will support the true benefits and healthcare transformation that states are moving towards.
Marty, any thoughts on getting out of the data swamp?
Yeah, no, I agree with everything Kat said. Obviously, like I'm all about the data. So organizing it, having a strategy, getting creative about data sources, all of that is, you know, using AI. Like we had a client who had some limitations on how many folks they had available in their community relations team, and they were trying to divide them up across counties in their state and have the right fit. And I literally went to AI to find out like what languages are prominent in each of these counties and what you know, like what are the specific qualities about the people that live in those counties, and if you could mirror some of that in your community relations team, how much more effective would you be at locating folks and getting them redetermined and enrolled? And that's one way that I think AI is a big help. And I also think that, like I was doing, say, like we were doing already with our clients, like automating these comparisons between the two systems, eligibility and MIS and MMIS, and pointing those out to MCOs and states about like where the discrepancies are, so that you can then have a collaborative conversation around how to go forward. sometimes our best advice is just like stop disenrollment until you can figure out what's broken, right? Don't keep digging if you're in the hole. And that requires this no blame culture, right? Because states are sensitive when things are wrong. They don't want to be the reason that people are not getting their benefits. Nobody wants that. And so the conversation has to be crafted in such a way that that we're all shoulder to shoulder against the problem that's keeping folks from getting their benefits, instead of pointing fingers and trying to decide whose fault it is. Who cares? Let's just fix it. And I think being creative, going through trade associations where multiple MCOs can have stakeholders present in a non-competitive environment to share information about what they're seeing, can give weight to the conversation with the state. It just validates what we've seen in the data. If multiple MCOs say, yeah, we saw that too, right? And then, the more people you have pointed at a problem, really invested in solving it, the more ideas you're going to get about how to creatively fix things tactically, like in the short term, and then also to look at that root cause analysis to fix things strategically in the long term. And I think combining insights from those people in the front line who have that spidey sense about what's actually true, and where people are and what the system actually does, is so critical, because I can look at all the data in the world, but a 5-minute conversation with someone who's on the front lines and has been living with this longer than me can really amplify the work that I do and point me in the right direction. And I think, like Kat said, having those stakeholders at the table is vital to solving this problem in the long term.
Exceptional. Thank you both. I am looking to see if there's any questions in the chat. I don't see any. I'll give people a second or two to share, but otherwise, I just want to thank both of you for really sharing your insight and doing so in such a crystal clear way. I think will be beneficial to all who are present here and who can view it later this year and forevermore. Is there anything here? I think we're good. So Marty and Kat, thanks again, and we look forward to the next webinar, which we should be showing in February 2025. Stay tuned.
Thank you.
Everyone.
Thanks for having me.
Absolutely.